Hey everyone, this is Jonathan Marks from GoToHealth. I hope you're having a great day. For the 1 in 5 Americans, that's 20%, who live in rural communities, a cancer diagnosis can mean driving hours just to see a specialist and sometimes several times a week. Fewer than 6% of U.S. oncologists practice in rural areas, and an estimated 60% of rural communities lack an active general surgeon. As a result, rural patients are less likely to receive guideline-recommended cancer care, including chemotherapy, radiation, and survivorship services. Cancer death rates are about 15% higher in rural communities, and the gap continues to widen. The American College of Surgeons Commission on Cancer aims to change that with a new rural accreditation category that brings evidence-based quality standards to rural hospitals while tailoring requirements to reflect their available resources. Our guest today is Ronald J. Weigel, MD, PhD. He's medical director of the American College of Surgeons Cancer Programs and professor of surgery at the University of Iowa Carver College of Medicine. So welcome to the show, Dr. Ronald J. Weigel. How are you today?
Very good, Jonathan. I'm happy to be here. Thank you for the interview.
Good, my pleasure. So tell us, what are the biggest barriers that rural cancer patients have and facing, or accessing high quality cancer care close to their homes?
Yeah, thank you. It's a big problem for patients who live in rural areas. And we've been aware for quite a while that there are cancer disparities, and patients in rural areas have a difficult time accessing quality care in their own rural community. About 60% of rural counties don't have a general surgeon, and 2/3 of them don't have an oncologist. And so particularly with cancer care, it's quite difficult for patients to get high-quality access to cancer treatment. Patients in rural areas have about a 15% worse survival. And with cancer treatment in particular, it's complicated because you're treating them and you're doing that to have a change in their survival 5 and 10 and 15 years later. Yeah. And so we have to understand, we have to have data to know what do we need to do today to have this impact 5, 10, 15 years from now. So the American College of Surgeons Commission on Cancer uses evidence-based standards to make sure that what we're doing today will translate into improved outcomes in the future.
I love the fact that you use the word evidence-based because that's what our channel is all about. Thank you for mentioning that. So I understand the American College of Surgeons has come out with a new accreditation category for rural hospitals. What does that mean and what is it?
Yeah, so the American College of Surgeons Commission on Cancer has had a number of categories in the past. They all have exactly the same standards, and the rural category that we just started has the same standards. And the way this evolved is there was a group in Kentucky called the McCann. It's the Marquis Cancer Affiliated Network, and they created a network to accredit hospitals in rural Kentucky. And that program was very successful. And then there was a program that was developed, a research program developed in Iowa by two researchers there, Mary Charlton and Ingrid Lizarraga, who are both at the University of Iowa. And what they did is they modeled after the McCann, they created the ICANN network, the Iowa Cancer Network. And what they did was they went into rural hospitals in Iowa, helped them become accredited by the American College of Surgeons Commission on Cancer. And what they found when they compared those hospitals that became accredited versus a set of hospitals that did not, that when they were accredited, patients then received the same high-quality recommended treatment that were being received in urban and suburban settings. And so based on that, we worked with those researchers in those other areas and got advice from them about how to modify the American College of Surgeons Commission on Cancer standards to be more in line with the resources available in a community setting and that the patients who are normally treated in those rural settings. So we created a new set of standards very much modeled after the Commission on Cancer, but modified slightly, but with the same quality standards.
Got it. So, question, you said before that most rural communities don't have a surgeon or they don't have an oncologist. So how are doctors in these rural areas getting trained to be surgeons and oncologists? Is that how this accreditation program is working? What's happening?
Yeah, so it's works through a variety of different mechanisms depending upon the resources available at that hospital. One thing that we've found is that as hospitals become accredited through the American College of Surgeons Commission on Cancer, they actually find that they have an increase in patients going there to have their treatment, number one. Mm-hmm. Number two, they are able to standardize the care, which lowers the total cost of care. So what that actually does is they're able to retain and recruit surgeons who have cancer specialty. In addition, part of what we do with this program is there's an educational component so that we can keep those surgeons and other clinicians, medical oncologists up to date. There's also tumor boards where individual patients' care is discussed amongst individuals. Some of those individuals may not be there. They may be at a large academic medical center, but through video conference, they now have a tumor board where they can discuss the patient's care and then decide what can be taken care of there and what does the patient have to travel for, and then create a system along with that to have patients referred as appropriate to get their quality care that they need that might require a treatment at another facility, but then also make sure that the treatment that they receive at that facility in their community is of high quality.
That's brilliant to have basically a virtual cancer board. That's amazing. A tough question, I think. It's hard to recruit doctors into rural communities because I assume the pay is not equal to what it could be in a more urban setting. And the other question I have is I've been reading or hearing about the threats to quite a number of rural hospitals being closed because of cutbacks in federal funding. So how's all this going to work with those two situations, if you don't mind sharing your insight?
Yeah, for sure. These are important issues. And we clearly need additional effort in advocacy for our federal and state governments to provide funding for those rural hospitals. No doubt about that. That's part of the solution. But as I said earlier, part of the issue of maintaining those hospitals is keeping your clinicians having enough patients that they can actually earn a living. Mm-hmm. And so as they become accredited, they then increase their capability of taking care of patients, and that provides some stability to that environment. In addition, we have training programs, and the American College of Surgeons is working very closely with rural programs to train surgeons to give them certain types of expertise that they're certainly capable of with appropriate training to be able to take care of things in their community so that patients don't have to travel. In addition, giving them, the American College of Surgeons is working with rural programs to also treat patients who may have urgent and emergent situations so that they can be treated locally and then only transfer it if necessary. So there's definitely a multi-pronged approach to be able to care for patients in those rural communities. But the American College of Surgeons has taken this as an important initiative, and it's a major part of the programs for the college, not only in cancer, but in many other areas of care.
Great. Thanks for that. So tell me, what can patients in rural communities do now to ensure they receive the best available cancer care?
So a couple things that they can do. One is they need to be proactive in taking care of themselves and informing themselves. And the American College of Surgeons, helps with that. There's a website that's been created, facs.org/rural cancer, that patients can look up what hospitals are local to them that are actually accredited by the American College of Surgeons Commission on Cancer. In addition, there's a lot more information on that web page about resources that are available in rural communities, in their community, for providing high-quality cancer care in that location.
Good. Let me repeat that website. It's facs.org. That's for the American College of Surgeons, facs.org/rural cancer. And what I want to encourage people who live in rural communities, or if you know someone who does, really to not be a victim to the fact that there's been such great challenges to getting care nearby, but actually taking this under your own advisement and going to facs.org/rural cancer to learn more about how you can get improved care in your community.
Absolutely.
Good. Doctor, are there any questions I didn't ask that I should have, or what kind of big message would you like to leave with people today?
Well, so the FACS stands for Fellow of the American College of Surgeons, and the American College of Surgeons has, for over 100 years, worked tirelessly with one goal in mind: improving surgical care for patients. That's what they're all about, high-quality care. And they do that through a variety of ways. And in cancer, the Commission on Cancer, which was established over 100 years ago with the goal of improving quality care for cancer patients. And so this has evolved along with the National Cancer Database so that we can collect data on those patients. That database is incredibly important in order to understand what it is that we do that can actually improve care for cancer patients and improve their survival. So all of these work in unison and are all supported by the American College of Surgeons.
Good. Thanks so much for being with us today, Doctor. This is an important message, and we're going to work hard to get it out to as many people as possible.
Thank you. Pleasure to be here. Appreciate it.
Good. We've been talking with Ronald J. Weigel, MD, PhD, MBA, and FACS. He's the medical director of the American College of Surgeons Cancer Programs, and he's also a professor of surgery, surgical oncology, and endocrine surgery at the University of Iowa Carver College of Medicine. Again, thanks for being with us today, Doctor. It's been very helpful.
Thank you. Appreciate the opportunity.
Good.
Have a good day.
This has been Jonathan Marks with GoToHealth. Remember, you can watch us on our website, gotohealthmedia.com. You can also watch us on YouTube, listen to us on 8 podcast networks. We're also on Roku TV and Fire TV, and we're also on all your phone apps. So you can get evidence-based medical information wherever you are. Thanks for being with us. This has been Jonathan Marks with GoToHealth, and as we say at the end of every show, go to health. God bless. We'll see you again next time. Bye-bye.
Bye.
Thank you for tuning in today to Go to Health. You are one of almost 10,000 people per day who enjoy the evidence-based health information offered by our guest health experts. You can watch us on our website and YouTube and listen to us on 8 podcast networks. Be sure to join Jonathan Marks in our upcoming shows each week. If you like our show, please share this episode with your friends and colleagues. You can subscribe to the show, join our email list, send us feedback, browse through the online store, and view our library of over 150 shows at GoToHealthMedia.com. See you next time, and remember to elevate your life with Go to Health.